Hi, my name is Susan Edlin Butler. I am a BSN student with ECPI University. This is my pathophysiology presentation on left-sided heart failure. Dr. Keith is the instructor. I will be referring to my notes intermittently throughout the video because unfortunately my memory does not serve me well, and that's what part of aging is memory. So anyway, I'm going to introduce you to Mrs. Constance Weiser. She is a 72-year-old white female, widowed, living alone in a senior apartment complex on the second floor with a working elevator. She uses a rollator gate. She does have O2 at 2 liters nasal cannula with a portable oxygen concentrator that she uses when she's away from home. She uses the complex bus to get to and from physician appointments and grocery shopping. She is pleasant and cooperative. She is a do not resuscitate. She has a healthcare advocate as well as a POA. She has, her diagnoses include left-sided heart failure, diabetic neuropathy, hypoxia, essential hypertension, and unspecified hypothyroidism. She has a very long list of medications, none of which I'm going to read out, but I'll refer to them intermittently throughout this presentation. She is 5'5" and 248 pounds and has a BMI of more than 43. She's up to date with her immunizations, her colonoscopy, and her mammogram. Her labs are all within normal limits. At a most recent PCP visit, her A1C was 7.2. Her creatinine was also within normal limits, and she sees Dr. Hart to manage her heart failure, Dr. Allivit for primary care, Dr. Footy for a history of a diabetic foot ulcer where she gets her diabetic shoes yearly. She also sees an eye doctor for her retinopathy, a diabetic retinopathy. Excuse me. So she's presented to the emergency room today. I'm sorry about my touching my nose. With an 11-pound weight gain, increased shortness of breath. Her chest x-ray shows that she has fluid around her lungs. Her most recent echo 2 years ago showed an ejection fraction of more than 55%. Today it shows 35%. She's going to be admitted to the telemetry unit. She'll have strict INOs, daily weights, and daily chest x-ray. She will also have blood gases drawn on a daily basis. She's been referred to electrophysiology for arrhythmia. She's been referred to cardiology for her heart failure. She has been referred to the hospitalist and the nephrologist because today her creatinine is elevated at more than 2. Her glucophage has been discontinued in the event that she needs to receive IV contrast, and as you all know, when people are on glucophage and they get IV contrast, it could possibly lead to kidney shutdown. So anyway, Mrs. Weiser has been admitted, and we will manage her heart failure. So for heart failure management, according to the American Family Physicians, spironolactone, which is a potassium-sparing diuretic, is now again resurfaced as a tried and true treatment for left-sided heart failure. Apparently, spironolactone has been shown to decrease mortality in such patients who are New York Heart Association Class 4. It can be used in addition to such agents as angiotensin-converting, also known as ACE inhibitors. and beta blockers, which also decrease mortality. Spirolactone is claimed to work synergistically with the angiotensin converting enzyme inhibitors to provide more thorough blockade of the renin-angiotensin-aldosterone system. This is for medical management, of course, and not surgical procedure intervention. The pharmacology behind spirolactone is that the RAA system is the complete mechanism by which the kidneys control the cardiovascular system. The system goes awry in patients with heart failure, and the decreased renal blood flow is not due to low blood volume, but to a heart pump that is not working efficiently. And we already know that Mrs. Weeser's heart does not pump efficiently anyway because of her chronic diseases. So, an alternative to spirolactone treatment, there is a procedure called resynchronization for patients who have an arrhythmia in left heart failure. And Mrs. Weeser has now developed this arrhythmia, so she is a potential candidate. Once she's seen by the cardiologist, he will make that decision. So this tiny little pacemaker is implanted, and what it does is detects irregularities and emits these electrical impulses that spark the heart back into regular rhythm. So a study by the Journal of the American College of Cardiology, this study is aimed to evaluate the rate and predictive value of complete left-sided reverse remodeling in heart failure. So she could possibly be a candidate for this. So once we figure out what the best course of action will be, she will be referred to the case manager from home health management for strengthening, because of course on day of admission the goal is always to discharge home. If in the event that she does need strengthening medical management, she will again be referred to the heart failure clinic for medical management. And teaching, of course, at discharge will include daily weights, calling her physician for a weight gain of more than 2 pounds in one day or 5 pounds in 1 week. She will be followed up by her primary care physician within 2 weeks of discharge, and we wish Miss Weeser all the luck in the future. And thank you for listening to my presentation.